Good morning, everyone. We have Dr. Skousen here at the Center of Dental Professionals to talk to us about crowns and why they're important. And so he's going to answer a few questions that some of our users have been asking over the last few weeks. So the first question is, Dr. Skousen, for those who may be looking at getting a crown for the first time, or for those that are not familiar with them, what is a crown?
Okay, well, thank you. A crown falls into the category of a prosthetic device for our tooth. Usually, if a tooth's broken, or if we've had a root canal, or if we have decay that consumes enough of the tooth that the tooth becomes structurally unsound, we have a device that goes over top of the tooth. And in this case, it's called a fixed device in the sense that it doesn't come in and out. I have one here to show what these look like. This happens to be a crown for a front tooth or an anterior tooth, and so what this would do is this would go over top of the tooth if the tooth did not have the structural integrity to stand up to everyday abuse of eating, and it would keep my tooth from breaking. And as you can see, these are made of porcelain or zirconia or other very strong substances that allow me to eat my food and stay happy.
Oh, that's very interesting. At what point is a crown necessary versus just doing a large filling?
It's a good question. We can fill any tooth with our filling material. However, the goal behind dentistry isn't just what can I make work. It's what is going to help my tooth be strong enough to eat for the long term. And so once we have too much filling material on a tooth, it becomes weak, and the odds of it lasting our lifetime go down dramatically. That's the time for a crown.
Interesting. And so you mentioned that the crown kind of goes over the top of a prepped part of the tooth structure. So what exactly does that crown do for a tooth when it goes over the top?
Okay. Yeah, it's really about physics. It's what's called a ferruling device, sort of like the band at the top of a wine barrel, keeping the boards in. It keeps the rest of your tooth in. So as it tops the tooth, it makes it so that the cusps of the teeth, or the high parts of our teeth that we normally use for cutting and grinding against, they aren't levers to break our tooth. And so as it covers the tooth, it creates an environment where every time I bite and chew, I'm pressing the tooth together instead of pulling it apart.
That's
it makes
interesting.
It last a long, long.
Yeah, that's a great analogy.
Thanks.
And is crowning a tooth damaging or bad for the tooth?
Yes and no. If the tooth were what's called a virgin tooth, where there's nothing wrong with the tooth, we wouldn't want to crown a tooth because we'd have to remove too much of the tooth structure. But if a tooth is mostly filling material, or if it's been root canal treated and is therefore going to be a brittle tooth, then no, it's a great upgrade to your tooth, and will make it last a lot longer.
Got it. And how long does a crown last typically?
Typically, you're going to get at least 20 years out of a crown. That's if the crown's very well done. There are different types of crowns, however. And so the best materials, ceramics and zirconias, and in some cases gold crowns, and those will last a very, very long time if they're done correctly by a good doctor.
Got it. And so why are
crowns are so expensive? Because a lot of it and having it work the way people want it to work. Anybody can throw anything on top of a tooth. It's just as to whether it works for a long period of time. The other thing is the laboratories that create these and the machines that create these crowns are very, very expensive. They're $1 million milling machines, and most of us dentists have spent, I've spent about $500,000 going to school. So it takes a long time to learn how to do it, You have to be very careful for not to hurt the patient and to do it correctly and right. But when it's done well, it lasts a very, very long time, and it's well worth the money.
And so, should I or someone investigating, thinking about maybe getting a crown, should they get one, or should they wait, or should they just get the tooth extracted? What do you recommend there?
Now, this is a good question, and it's a question that's very individual as well. I recommend that you visit with your provider and ask them that question. However, if your provider has told you you need a crown on a tooth, usually the majority of the time it's a great idea. And for those of you that are worried about it becoming, is this going to hurt my tooth? Is this going to hurt? All of those things. They're relatively fast and relatively painless procedures, and the outcome is not only looks better, but functions a lot better, and it's going to last you a very long time.
Fantastic. Well, thank you for that short tutorial on what crowns are and why they're important. And we hope everyone today that watches has an amazing day. And if you have any questions, please comment down below the video. Thank
Thanks.
you.